The diagnosis came on a Tuesday in March. Stage 2 breast cancer. Triple negative, the aggressive kind. I was 32 years old, trying to process words like mastectomy and chemotherapy and survival rates. "We need to start treatment immediately," Dr. Lauren Martinez said. "I want you in chemotherapy within 2 weeks. The earlier we hit this, the better your outcomes." I called my sister Rebecca on the drive home. She was a physician assistant at Georgetown Medical Group, the golden child our parents constantly bragged about. "Becca, I just left the oncologist. I have breast cancer. Stage 2. They want me to start chemo in 2 weeks." Pause. Then, "Oh. Well, that's unfortunate timing." Unfortunate timing? My wedding is in 8 weeks. I've been planning this for a year. Surely they can delay the chemo? It's only 2 months. I pulled over. The oncologist said we need to start immediately. Every week we wait, the cancer could spread. Oncologists always say that. They're overly cautious. A few weeks won't make a difference. What will make a difference is if my maid of honor isn't there because she's too busy seeking attention with doctor visits. Seeking attention? You've always had a flair for drama. First your anxiety in college, then your chronic migraines. Now this. The timing is very suspicious. Right when I'm about to have the biggest day of my life, suddenly you have a medical crisis. I have cancer, Rebecca. I have biopsy results. Scans showing tumors. Fine, you have some cells that need treatment. But you're making this into a huge production. Do you know how much stress you're adding to my wedding planning? Just schedule your little health issue around my wedding. Is that really too much to ask?" She hung up. I worked as Chief Compliance Officer for the State Medical Licensing Board, the department responsible for ensuring medical professionals maintained licenses and followed ethical guidelines. Every complaint against a doctor, PA, or nurse practitioner came through my office. I investigated misconduct and made recommendations about license suspensions. Rebecca was one of those licensed professionals. Her PA license was active and in good standing. She'd graduated top of her class, worked at a prestigious practice, and made significantly more money than I did. I started chemotherapy on March 28th. 6 rounds of aggressive treatment. It was brutal. Constant nausea, hair falling out in clumps, exhaustion so severe I could barely walk to the bathroom. My immune system tanked, meaning I had to avoid crowds and wear masks everywhere. Rebecca called during my first cycle. "Have you talked to your oncologist about postponing treatment yet?" "No, Becca. I'm not postponing cancer treatment. You're being so difficult. Mom told Aunt Patricia you might not be at my wedding because of your health issues. Do you know how humiliating that is? People will think something is seriously wrong. Something is seriously wrong. I have cancer. You have a medical condition that's being treated. Stop being dramatic. Plenty of people have cancer and still show up for important family events. You're using this as an excuse to ruin my wedding. I'm trying to survive. Whatever. Just so you know, if you're not there on May 20th healthy and ready to fulfill your maid of honor duties, I'm never forgiving you. This is the most important day of my life, and you're making it all about your little health issue." My best friend Sarah became my support system. She drove me to appointments, held my hand during infusions, brought me ginger ale when I couldn't keep anything down. My colleagues covered my work and sent care packages. My family sent occasional texts asking if I'd reconsidered the timing of my treatment. By mid-April, I'd completed 3 cycles. I was skeletal, bald, barely functioning. The cancer markers were dropping. The treatment was working, but I'd lost 26 pounds. My skin had a grayish tint. Rebecca's wedding was 4 weeks away. She called with updates about flowers and seating charts. She never asked how I was feeling. "The bridesmaid dresses need final alterations. You need to come in this weekend." "Becca, I'm in the middle of cycle 4. I can barely get out of bed. It's 1 appointment. 2 hours. Surely you can manage that for my wedding." "I'm immunocompromised. I can't go to crowded places." "Stop making excuses. You're using your condition to get out of every responsibility. Do you know how much stress you're causing me?" I hung up on her. The next week, Rebecca showed up at my apartment unannounced. I answered in pajamas, a knit cap covering my bald head. She physically recoiled. "Oh my God, Mara. You look terrible." "I'm on chemotherapy." "Well, you need to do something about it before the wedding. Get a good wig, professional makeup. My wedding photos can't have you looking like this. I'm doing the best I can. Your best isn't good enough. This is my wedding. You're going to ruin it by looking like a cancer patient in all the photos. I am a cancer patient. Stop saying that. Stop using that word. You don't have to make it your whole identity. Some people have cancer and you'd never even know. Why can't you do that? Because I'm sick. Because the chemotherapy is destroying my body. Because I'm fighting for my life. You're so dramatic. Plenty of people go through chemo and function normally. You're just milking this for attention. Get out. Excuse me. Get out of my apartment. No. And I'm not coming to your wedding. Her face went red. What? I'll be in my 5th chemo cycle on May 20th. I'll be sick and immunocompromised. And even if I wasn't, I wouldn't come. You've made it clear that your wedding photos are more important than my life. You're my maid of honor. Watch me not show up. She left, slamming the door. My phone exploded with texts from family telling me how selfish I was being, how I was ruining Rebecca's special day. None asked how I was feeling. I turned off my phone and focused on surviving. In early May, I was working from home reviewing licensing applications. A routine report crossed my desk. Annual compliance for Georgetown Medical Group. Every practice had to submit documentation proving their staff maintained current licenses. Rebecca's name was on the list. I should have recused myself immediately, but something made me pause. Her license was current. Her continuing education was complete. But there was a note. 3 patient complaints filed in the past 8 months, marked pending investigation. Patient complaints came through our office, but initial investigations were handled by the practice's internal review board first. These 3 hadn't been escalated, which meant Georgetown was handling them internally. I shouldn't have looked deeper. But I did. The complaints were similar. Patients feeling dismissed, symptoms minimized, concerns labeled as anxiety without proper diagnostic workup. One patient complained Rebecca told them their chest pain was probably just stress without ordering an EKG. They'd had a heart attack that night. Another said Rebecca dismissed their abdominal pain as probably just gas. It was appendicitis that ruptured. The third complaint made my blood run cold. A 40-year-old woman came in with a breast lump. Rebecca told her it was probably just a cyst and to wait and see without ordering a mammogram. The patient insisted on imaging. It was stage 3 breast cancer. Rebecca was doing to her patients exactly what she'd done to me. Minimizing serious symptoms, dismissing legitimate concerns, prioritizing convenience over proper medical care. I called our chief legal counsel. Tom, I have a situation. My sister is a PA at Georgetown. Her file has 3 patient complaints that weren't properly escalated. I need to recuse myself, but Georgetown may be suppressing complaints to avoid board review. That's serious, Mara. 3 complaints from 8 months, all involving failure to properly assess patients, resulting in delayed diagnoses. None were reported to us as required by state law. Your sister is involved? Yes. I'm recusing myself from her case. But the practice's failure to report is a separate compliance issue. I'll assign Rebecca's case to another officer and open an investigation into Georgetown's complaint reporting. The investigation moved quickly. When our office requested Georgetown's internal records, they discovered not just Rebecca's 3 complaints, but 7 others involving different providers that hadn't been reported as required. Georgetown Medical Group was under formal investigation. Every provider, including Rebecca, would undergo individual license reviews. Rebecca's hearing was scheduled for May 18th, 2 days before her wedding. My phone exploded again. Rebecca screaming about how I'd destroyed her career out of spite. My mother crying about me tearing the family apart. My father demanding I drop this vendetta. I didn't respond. The hearing officer, Sandra Chin, was thorough and uncompromising about medical ethics. Her findings were damning. Rebecca had dismissed patient concerns without proper diagnostic workup, failed to order appropriate tests, and showed consistent lack of clinical judgment that put patients at risk. The patient with delayed breast cancer testified. So did the patient with the missed heart attack. They trusted Rebecca's expertise, and that trust had nearly killed them. Sandra's recommendation: 6-month license suspension, mandatory ethics training, psychiatric evaluation, and 2 years of supervised practice upon reinstatement. The medical board accepted unanimously. Rebecca's license was suspended May 19th, the day before her wedding. Georgetown terminated her employment immediately. He called that night screaming, "You did this. You destroyed my career, my wedding, my life. All because you're jealous." "I didn't destroy your career, Rebecca. You did. You dismissed patient symptoms without proper assessment. You put people's lives at risk. Those complaints were nothing. Minor issues blown out of proportion. A heart attack is minor. Stage 3 cancer is minor. Or do those only matter when it's happening to you? This is different. No, it's not. You did to your patients exactly what you did to me. You minimized serious health concerns because acknowledging them was inconvenient. I had enough knowledge to advocate for myself. Your patients trusted you, and that trust almost killed them. I'm your sister. I'm a compliance officer. My job is to protect patients from negligent providers, even when they're family." She hung up. I blocked her number. The wedding happened without me. I was in the hospital that day. My 5th chemo cycle had tanked my white blood cell count, and I'd developed a fever requiring 4 antibiotics. Sarah sat with me while I fought off infection. Rebecca had a breakdown at the wedding, telling everyone I'd vindicatively destroyed her career. But the guests included medical professionals who knew about the investigation. They knew the complaints were real. The Whisper network was swift. I completed my 6th cycle in June. The scans showed no evidence of disease, complete response to treatment. I still needed surgery, but the cancer was gone. Dr. Martinez cried showing me the scans. "You did it, Mara." I cried too. From relief, from exhaustion, from months of fighting cancer while my family called it a little health issue. Rebecca's license review continued. She failed the psychiatric evaluation. The assessor found she lacked empathy and clinical judgment necessary for patient care. Her suspension was extended to 1 year with significant restrictions. She'd need remedial training, competency evaluations, and supervised practice. Many practices wouldn't take that risk. Her career as a PA was effectively over. My mother called 6 months later. "Rebecca is struggling. He can't find work. She's depressed. Don't you think this has gone far enough?" "Mom, did Rebecca ever ask how my cancer treatment went?" Silence. Did she apologize for calling my cancer a little health issue? For demanding I postpone chemotherapy for her wedding? For telling me I'd ruin her photos by looking like a cancer patient? More silence. Did she acknowledge she did to her patients exactly what she did to me? She made mistakes. She put lives at risk. One patient has the same cancer I do, except hers is stage 3 because Rebecca told her to wait and see, instead of ordering a mammogram. That woman's survival rate dropped 30 to 40% because Rebecca couldn't be bothered to order a test. She's your sister. And those were her patients. They trusted her. She failed them. My mother hung up. We haven't spoken since. I had my mastectomy in July. Surgery was successful. By October I was cancer-free and feeling human again. My hair grew back clear. I gained weight. Color returned to my skin. I returned to work in November with new perspective on medical negligence. I'd lived it, survived it, and made sure the provider who'd done it couldn't hurt anyone else. Sandra pulled me aside my first day back. The Rebecca Henderson case was one of the clearest examples of medical negligence I've seen. You made the right call. Thank you. How are you? Cancer-free. Alive. Back at work. I'm good. And your family? My family called cancer a little health issue, and demanded I risk my life for a wedding. I don't have much contact with them anymore. I'm sorry. I'm not. I learned who actually cares about me. Rebecca tried to get her license reinstated after a year. Sandra denied it. The psychiatric evaluation still showed concerning patterns. The training wasn't completed properly. She'd have to wait another year. And even then the complaints would be permanently on her record. I'm 34 now, 2 years cancer-free. I still work as Chief Compliance Officer. I carry knowledge that medical negligence isn't just incompetence. Sometimes it's a fundamental lack of empathy. Rebecca lives in another state working in medical billing. No PA license required. We don't speak. My parents send obligatory cards. The patient whose breast cancer was delayed reached out last year. She'd completed treatment and wanted to thank me. You probably saved other people from going through what I went through. That meant more than any family relationship. My little health issue is gone. The family who dismissed it is gone too. And I'm finally healthy in every way that matters. I mentor young compliance officers now, teaching them that objectivity doesn't mean ignoring patterns of harm. That holding professionals accountable isn't vindictive, it's essential. Last month, a case crossed my desk. A provider dismissing patient symptoms as anxiety without proper workup. The patient nearly died from a pulmonary embolism. I recommended immediate suspension. The provider's family called it excessive. They said I was being too harsh, too unforgiving. I thought about Rebecca. About her patients. About myself, bald and dying while she planned centerpieces. The suspension stands, I told them. Some people never learn that dismissing suffering has consequences. But I make sure those consequences come. Every single time.